and chronic diseases. Epidemiology does not only play a role in infectious diseases or diseases that are seasonal. It plays a very strong role when it comes to chronic diseases as well. It identifies the risk factor. It also helps observe long-term trends. We have read about, I'm sure you guys have done your readings and read about the Framingham study, which started in 1948, when infectious disease mortality had dropped to approximately its current low levels. The deaths from heart disease increased dramatically during the first half of the 21st century, and this study wanted to document what's happening what's happening as far as cardiovascular disease or heart disease is concerned. The Framingham study revealed a great deal about how to predict which of these subjects were likely to develop heart disease. The study identified three major risk factors: high blood pressure, high blood cholesterol, and smoking. It was an epidemiological study that was very helpful in identifying what really causes the heart disease. Another very important study in the history of epidemiology is the Hammond-Horn study in United States. They conducted a study by obtaining smoking histories for almost 188,000 men, and these men were followed for a period of 3 years. For all the participants who died, the researchers collected the death certificates, and their finding confirmed that first cigarette smokers were more than 10 times more likely to die of cancer than non-smokers. In the next couple of chapters, we will try to study what are the different kinds of studies that become a part of epidemiology study. Some of them are retrospective, some of them are prospective studies, and we will discuss in detail how these studies help in understanding the disease pattern, the trends, and the risk factors. Another very good example of epidemiology and chronic disease is lung cancer and smoking, which was done by British physicians. The death rate from lung cancer was about 20 times higher among smokers than non-smokers. Their study also revealed that death rate among ex-smokers were lower than that of smokers and declined as the length of time increases since the individual had quit smoking. Contrast in lung cancer mortality between smokers and non-smokers was the same, irrespective of living in rural or urban areas. So in this case, we can conclude that geographical area or geographical location did not play a strong role in studying lung cancer and smoking. Thus, improving the impact of air pollution on lung cancer was identified. Death from heart attacks were significantly higher among heavy smokers aged 35 to 54 rather than among non-smokers. Epidemiological surveillance. What is epidemiological surveillance, you might be wondering? It's a system that has been developed by epidemiologists to be able to take actions before the disease or illness has an impact on the majority of the population. This is where epidemiological service system is used. What basically epidemiologists and public health researchers do is, based on their epidemiological research and survey, they develop a certain trend, they develop certain risk factors, and this is where they can follow how the disease is progressing, what part of the region or the state is this disease progressing. Usually, epidemiological surveillance works for infectious diseases. It is important because we need to take action before these diseases are spread. In United States, approximately 60 diseases have been identified by law as notifiable at the federal level, including, for example, hepatitis, tuberculosis, measles, and syphilis. What happens under epidemiological systems is that states require the reporting of all infectious diseases related cases. Say, for example, you are a doctor or a nurse or a medical practitioner in Macon area, and you identify a patient comes to your clinic or your hospital and you suspect that the patient has syphilis. You are required to conduct some of the initial tests to confirm if the patient has syphilis and report the case to the state and the federal level, depending on what the reporting system in that area is. Epidemiological system requires compulsory notification of notifiable disease as soon as they are diagnosed. Most commonly, the infectious diseases are listed among the notifiable diseases, those which can be prevented if timely and appropriate actions are taken. Some of the examples, as I mentioned a few minutes earlier, are tuberculosis, hepatitis, measles, and syphilis. In United States, all hospitals and clinical labs must report any case of a notifiable disease or condition to their local health department. Now, the local health department further reports the same to the state health department, and these numbers are finally reported to CDC. Epidemiology also plays a very significant role in the outbreak investigations. What is an outbreak? When suddenly we have a huge number of cases for a specific illness or a health condition. Say, for example, if in Georgia they expect that 500 people will be diagnosed and suffer from flu next year. But say next year when the flu season comes and you have 1500 cases, much more than the expected number, this is where it is called an outbreak. And what epidemiology does, what epidemiologists do, they verify the diagnosis. The very first thing they do after the diagnosis is they construct a working case definition. They find cases systematically, which is called active surveillance. They ask the who, where, and when questions to describe the epidemic by person, place, and time. And doing this, they also take care of the incubation period. Now the epidemiologist will look for a common source of exposure. Let me share an example with you here so you are more clear about how and what an outbreak investigation is. Say, for example, at Mercer campus, there are students who eat in the different cafeterias on campus. And some of the students do go out and eat in other restaurants in and around Macon. Say a student health center at Mercer reports that 100 students had upset stomach last night. So this is an outbreak. You will first verify the diagnosis if everyone had an upset stomach, and then you will construct a case definition. Whom do you describe, or whom do you define, or whom do you identify as having an upset stomach? Now you will ask the questions who, where, and when. You will ask who all are affected. Are these people, or are all these students from a certain dorm? Then probably something happened in the dorm. Are these people scattered all over the campus? Okay, then the next question will be, did all of them eat at the same place? Did all of them eat at one cafeteria or one restaurant? Another question would come to your mind is, when did all these people eat? Say, for example, if everyone ate at cafeteria number A, and if everybody ate there between 12 and 2 p.m., that means there was something that happened with the food during those times. That's why the students are affected. You look for a common source of exposure, and that's where you declare it as an outbreak, and then you try to deal with it in the sense, once you have identified if it happened at a cafeteria or if it happened at a restaurant across campus or somewhere in Macon, this is where you will proceed as an epidemiologist to inform people, educate people, and make sure that there is enough education and awareness about people to avoid either the water supply or the food, or take some precautionary measures so that we can curb the morbidity and mortality resulting from this. Next class, we will be studying what are the different kinds of epidemiological studies. Now we have understood what is epidemiology, what does it do, what are its underlying principles, what are some of the objectives, what do we mean by epidemiological surveillance, and what do we mean by outbreak investigation. Next class, we will study what are the different kinds of studies? What are the different methods that epidemiologists employ to come to these conclusions? I hope you guys are keeping up with your readings, doing well in your quiz, and going through and responding well to the discussion questions. I look forward to connecting with you again next week. Have a great time. Take care.